Welcome back to Monday Special. Thank you so much for staying with us, where tonight we're discussing epilepsy, and like we said, it affects about 400,000 people in Kenya. But there's a lot of myths that go along with epilepsy that stops people from accessing the right kind of information or even medication, and that's what we really want to demystify on the show tonight. I'd like to introduce my panel now. The gentleman sitting directly across from me is Charles Njoroge. He's a case study, and he'll tell us how long he's been living with epilepsy, how he's managed it, and his own message to Kenyans. Next to Charles, we have Sitawa Wafula, who's been on the show before, but she joins us tonight as well as a case study, living with epilepsy, and she'll tell us more about the work that her foundation is doing to help raise awareness about epilepsy. And then we have Dr. Samson Guer, who's an epilepsy specialist, who's going to answer a lot of the questions most of you have been sending about what it is, how to manage it, and that kind of information. Thank you all so much for being here. I think I'll start with you, Doctor, before we hear from Sitawa and Charles on their stories. If we can just sort of run through, first of all, what is epilepsy?
Well, epilepsy really defines an increased risk to have seizures, where seizures mean an aberration in the electrical activity of the brain that causes you to have a number of manifestations. What people commonly know is the jerking and stiffening movement. But it can manifest differently. It can be subtle, like a staring gaze, or just some twitches on the finger, the eyes, or just quiet, so you don't see anything. So some people have these fits, but it doesn't necessarily mean they're epileptic. Is that what you're saying? Like some people still have seizures? So think of seizure as a symptom. Yeah, so it's a manifestation of something happening. And so when it's recurrent and provoked, then you are said to have epilepsy. But it can happen in the context of febrile illness. For instance, in young children between 6 months and 6 years, when they have high fevers, they may actually get seizures. What are some of the causes or risk factors of epilepsy? Well, essentially, anything that causes damage to the brain can cause epilepsy. And normally, you know, you have some electrical activity that controls your functioning, and anything that will interfere with that. It can be genetic, it can be birth asphyxia or damage during birth, it can be trauma or an infection. It can occur anywhere in your life. In any way. So you say you can be born with it? You can be born with it, yes. Yeah. But the manifestation may not necessarily be at the time of birth. It can be later in life, it can be early in childhood. Yeah. So and who gets epilepsy? Anybody can get epilepsy. Children as young as how old? It can manifest as early as infancy, and up to very old age. And essentially, because all these things I'm saying, the risk factors for causing epilepsies are things that can happen to anybody, it means that anyone can get epilepsy. Wow. Yes. Okay. And like you say, things like an accident or trauma that can cause epilepsy. And then, of course, later on we'll be talking a little bit about how to handle someone who has an epileptic fit. We now want to hear from Charles and Sitawa. And Sitawa, we'll start with you. Your own story with epilepsy. How did you learn that you had epilepsy?
Okay, cool. So mine started when I was in Form 4. Second term, and I was a dorm prefect, and we had inter-dorm games, and my dorm won, and we just had all these songs that we sing, and we went for dinner, and I tried eating, but my teeth would not stop gnashing, so I just had this movement, and the nurse couldn't explain what was happening, so she just told me to relax, and then maybe it will go away, but it stopped, and she asked me, do you have headache or jaw pain? I said no, but she was like, just go to the dorm and relax, and then in the morning we'll see if it goes on, then we'll have to take you to hospital. But Form 4, second term, you're telling me to go relax. MOOCs are around the corner, that's not happening. So I went to class, and then I'm left-handed, so my left hand started jerking on its own, so it looked like I'm marking papers, and so the rest of the class started looking at me, so I'm really trying to hold my hand, but I can't do it. And then I think in just that whole anxiety and all that, I had my first full-blown fit, and from then on I've just been having them. Do you know why? What caused your epilepsy? Oh, not really, and there's that type of, I know there's a scientific name for it, where there's a certain small percentage where the cause is not really known.
Yes, and of course the nomenclature has changed since, and we know that a significant number of epilepsies are caused by genetic causes. We used to say they are unknowns or idiopathic.
Yeah, that's the word.
Complicated, so you think it's a technical term. So it's idiopathic, is that what you said?
Idiopathic, that was the name, meaning that really we don't know the cause.
You don't really know.
But things have advanced now.
Okay, now you can kind of trace to the root of...
Yes, in our setting not so well because we don't do a lot of genetic studies, but we know that a number of genetic aberrations can actually give you epilepsy.
Oh wow. Yes. Before we move to Charles, so that was when you were how old?
17.
So you've lived with it for over a decade, or so to speak, about 10 years. And do you still have fits frequently, or?
They're not as bad as before.
Okay.
Yeah, so before it used to be, I couldn't be here without someone, or just even the thought of leaving the house was overwhelming for me. Yeah. But now it's very manageable.
What would trigger it for you?
A number of things. The weather, when it gets really hot or really cold, that's a trigger for me. Food, I eat a lot, so if I don't eat, then that's also a trigger for me. Also stress at times, so with work and with staff, that's also a trigger for me.
I'll come back to just asking more about how you've lived with it and what you're doing about it. Charles, could you tell us a little bit about your own story? When did you first find out that you had epilepsy?
First, I had come to some of these people who are bad people by night. I was escorting somebody. Okay. Then after the time I was coming back, that's the time I came to those people who are bad people. That was 93. Okay. Yeah, I had family. I was living in Kiambu. Okay. So it was a Kiambu sports club. Yeah. Yeah, they came from there. Okay. Then,
they were thugs?
They were thugs, okay. Yes. Okay. Then when they came, because there were so many, I think there were more than 12. So I was hit here. Yeah, I was hit. Okay. But that time the hospitals were not getting medicine. So I went to Kiambu, but I found my friends. They asked me whether I can manage to stay even without being injected because of the painkiller, because they didn't have. So they just bite me around.
Bandage,
yeah? No, they just came and started stitching. Okay. Yeah, around. Okay. Yes. Okay. So I was just feeding. But from that time, I went back home. Then after about a month, that's when I started. When I'm going to sleep, if I sleep about 20 to 30 minutes, and I had a problem with, let's say, without my family or something, so I was annoyed. That's the time when
you would have a fit.
A fit.
And this is since 1993?
93, yes.
Wow, 93. So you've lived with it for a long time. Yes. From that time till now, how did you learn to manage it? How have you learned to manage it in the right way?
I found my friend, because there was this Robati professor. He was called Professor Robati. He was one of the Nairobi hospital. And they were sponsored by Kawi.
Kawi is the... Yeah. What does that stand for? Kenya Association of?
The Welfare of People Living with Epilepsy.
Okay, Welfare of People Living with Epilepsy, yes. Okay.
So they came to our place at Waitaka, DA's office. They were given an office there. Somebody went and found them. Then he was my friend. Okay. He came and said to me, there is some people there. They are saying they are dealing with epilepsy. Can you go and see whether
they need help?
They can help you. Yeah. Yeah. Okay. So then I said yes. Okay. Then we went. That's when I found Dr. Robati. Then he asked me to see him at Nairobi Hospital. Then I was done EEG. EEG,
which is
electroencephalography, really looking at the electrical activity of the brain. Think of it as an electrician measuring whether current is passing through our eyes.
And you should only do that procedure if you're epileptic, or?
No, not necessarily. You will see it's an aid to a diagnosis of epilepsy. But really, we make a diagnosis of epilepsy on account of the history. What is the presentation? What's happening to the patient? All these other things then help you make a proper diagnosis.
Yes. So based on that, he was able to identify the issue.
There's a clot.
There was a clot.
Inside my brain.
And you can see what Charles is saying is it looks like his epilepsy was as a result of trauma. And like we were saying, it can happen to anybody.
To anyone. So you've talked about stress related. Maybe you can tell us about how you've managed. Sorry, my director is telling me. Do we have the Vox Pops? Okay, before we continue the discussion, like I mentioned, there's a lot of myths around epilepsy and in Kenya. And so we took our cameras to 1 or 2 different counties, and this is what people had to say when they were asked about what they know or think about epilepsy. So let's take a listen and then bring the discussion back to panel.
Zamani, mtu ambayo ilishikwa na ugonjwa ya kifafa ni kama ugonjwa ambayo haina matibabu. Sasa ni kama umelaaniwa sort of.
I've heard about it because it is the disease that we used to even hear when we were still young. People used to talk about it. And what I've experienced about it, you find somebody is collapsing and you see some mucus and whatever, and somebody urinate. So I thought it was, to my own aim, I normally know that it's inherited disease.
Haya ni maradhi ambayo kwamba yanaweza yakamshika kila mtu. Kimimi ninaamini kuwa ni maradhi ambayo Mwenyezi Mungu mwenyewe ndio huwa anayajalia kumpata mwanadamu.
Ugonjwa wa kifafa ni katika mojawapo kasoro katika hitilafu na Afrika katika ubongo wa mwanadamu ndio inasababisha hayo yote. Kwa sababu sio ati ni watu wote wale wana ugonjwa wa kifafa, ni baadhi katika watu katika jamii ambao wako na hao maradhi.
All right, so that's just some views from different counties, I think namely Kisumu and the coast in Kenya. Do you deal with a lot of this kind of thing, people maybe being misinformed or not really understanding epilepsy, as someone living with it and as an expert as well?
Yeah, definitely as someone living with it, there are a lot of misconceptions and just even with being in the field and listening to other people's stories. So like if I've used this glass to drink water, then you have families where, and then I have a special cloth wash for the...
Because they think it's contagious?
Contagious, yeah. So then they wouldn't want to share things with me because then they think they'll happen to get epilepsy. Also people think, oh, I can be in a relationship because then what will happen to the guy once we want to have kids? And those sorts of things. So there's a lot of misconceptions and lack of information about epilepsy. Yet it's something that you can live a quote-unquote normal life with.
And if you have it and you apply for a job, is it something that you should disclose, do you think?
That's a great area because I was fired from a job. The last job I ever had, I had a seizure and I fell on a client and I was let go because of that. So it's really a gray area. So I'll leave it to Dr.
Well, like you've said, in truth, there are lots of myths and beliefs that are pretty disempowering. And the most consistent narrative is that epilepsy has a spiritual origin or it has to do with witchcraft. And on account of that, people who suffer from epilepsy then see the solution being in the spiritual, you know, or some supernatural intervention. And that then means that they are mismanaged a lot. You can see then that there's a lot of stigma that surrounds epilepsy. And that really makes it disabling, while it really shouldn't be. Really, more than 70% of people with epilepsy are actually normal. They can lead normal lives for as long as they're on treatment and for as long as they're not getting their seizures.
Can it ever go, or do you forever live with epilepsy?
Well, it comes in different forms, and there are forms that actually evolve. They come at a particular time of your life and get out, and there are forms that persist throughout, and there are forms that change, you know. In early childhood, maybe they are pretty subtle, and then as you grow older, they are jerky, and essentially every person, every form has its story. But having said that, we're just mentioning something about jobs and how you can get treated in the workplace. It's not contagious. Everyone can get it. Anyone can get it. So you're pretty normal, honestly, and you should be treated normally. But there are risks. You obviously you can't be a pilot and really, if you still have active epilepsies, then you have to think carefully about driving, being in places where you're near fire or big water bodies.
So there's precautions to take, which I think we'll talk about later on. We want to take a short break, but we also want to demonstrate. There's a lot of people who have maybe seen someone have a fit or seizure, and they don't know what to do. They feel helpless. I feel like we want to break that tonight. So, you know, Sitawa has agreed to be our case study. She said as long as you treat her with care, which I think you will.
I will try.
All right, so we'll sort of move it to behind the studio a little bit and see what happens when someone actually has a seizure or a fit, and then we'll answer some of your questions on SMS and on Twitter. So stay with us. Remember to use the hashtag MondaySpecialKE on Twitter, or 22422 on SMS. And there's also a line, a helpline that we'll be giving to you later on. If you have any more questions about epilepsy, we won't be able to answer all of them. There's a line that we'll read out for you. Please take note of it, and you can get all the information you need. Stay with Monday Special.